Hello, thank you for joining us today. My name is Brianne, and I will be joined by Meg, Nicole, and Nisi. Today, we are going to talk about something that affects many older adults, and that's medication safety and how to properly manage your medications. As we get older, it's common to end up taking several medications, and in fact, 40 to 50% of adults over the age of 65 take 5 or more medications, otherwise known as polypharmacy. The thing is, taking a single medication can be beneficial, but taking many together can lead to harmful side effects or adverse reactions. These should not be overlooked. In this video, we'll be going over primary preventions. These will reduce risks by making some lifestyle changes and ensuring your environment is safe. The goal here is to prevent injury and disease before it occurs. We will also be going over secondary preventions. Will help determine what screening tests are appropriate, what warning signs to look for, and when to seek medical attention. The key here is detection and intervention. Tertiary preventions will give you the support and resources as well as management tools to aid your existing conditions and to prevent any further complications. But the only way we can achieve these preventions is with health promotion that emphasize on positive health behaviors and empowerment to manage your health and medications. Lastly, we'll be going over health considerations and community resources that address factors that could affect social determinants of health, which include your income, access to transportation, housing, and social support. So if you're ready, let's get into it.
Hello, my name is Margaret, and I'll be covering primary and secondary prevention. Primary prevention in medication safety and management. This involves strategies to prevent disease or injury before it occurs. This approach is important in reducing risk of adverse drug events. Key components include education and awareness. Being educated about the potential risks associated with medication can significantly reduce the likelihood of medication errors. Medication reviews. This can help identify and to mitigate potential risks of drug-to-drug interactions. Diet and exercise. A good balanced diet and physical activity can help manage conditions like hypertension and diabetes. Safe storage and disposal. Ensuring medications are stored safely and disposed properly can prevent accidental ingestions, especially in households with children. Clear labeling and instructions. Medications should be clearly labeled with instructions to prevent misuse. Screening programs. Regular health screenings can detect conditions early. Vaccinations. Being up to date with recommended vaccinations can prevent diseases that may require medication. I'm going to cover secondary preventions on medication safety and management. Secondary prevention focuses on early detection and intervention to prevent progression. They include blood tests. For certain medications, regular blood tests are necessary to monitor drug levels and organ functions. Blood pressure monitoring. For patients on antihypertensive medication, regular blood pressure checks ensure medication effectiveness. Signs of overdose or toxicity. Symptoms like confusion, severe drowsiness can indicate overdose or toxicity and require immediate medical attention. Symptom tracking. It is important to know symptoms that are not typical side effects that require immediate medical attention. This could save your life. Medication diary. Maintaining a record of your medication helps identify patterns or issues. And lastly, use of technology. The use of apps and devices will remind you to take your medications on time and to track your health.
Reviewing medication using screening tools is essential for management. Brown bag review is a medication review where all medicines, including prescription, over the counter, supplements, and herbal remedies, are brought in for review to assess inventory, condition, your knowledge, and adherence. You could also bring along your medication list. At this point, you can be screened using the stop or start screening tool, which determines which medications can be discontinued or need to be added, which brings us to deprescribing. This is a plan to wean you off medication as it is not advised to stop abruptly. Lastly, ensuring that your medications are not on the Beers list, which is a list of medications that are potentially harmful for adults 65 and older.
Hey guys, Nicole here. So I'm going to talk about tertiary prevention and medication management in the elderly. So our goal here is to manage existing conditions to prevent further complications. So one prevention we can do is just disease management. So, if you take 5 or more medications, talk with your provider. As a nurse, we can advocate for deprescribing if it's appropriate. For new meds, we can, go with the whole thing of start low, go slow to find out the lowest effective dose. Another thing we can do is some rehab. So some meds can cause side effects, as we know, dizziness, weakness. This just makes everyday tasks harder, which is never the goal. Taking 4 more meds increases your fall or your risk of fall by quite a lot, as Green stated in her lecture. Another thing we can do is just adaptive techniques. So things as simple as like a MAR medication list. I know a lot of people use pill containers, pill organizers. My parents do. It helps them manage their medications. And they can track their doses and see if they've taken it for the day. Another thing we can do is provide some support resources. So if cost is getting out of hand or the pharmacy is a problem, we can advocate for generics or assistance programs, possibly mail order pharmacy options. I know sometimes these are cheaper. And then from one of our lovely resources, I drew medication, education, and support have been shown to improve safe medication use in older adults. So the more we educate, the more they know what they're taking, the more compliant and the safer things will go for them, hopefully.
As we learned in primary preventions, safe medication storage is key. Here we have 3 examples of medication storage. We have our standard Monday through Sunday organizer. They also come in AM and PM. A monthly pill storage that consists of AM, noon, PM, and nighttime. We can also combine a secondary prevention, the use of technology, for our third organizer, which has a reminder function built in. Utilizing our tertiary prevention, adapting techniques, we have medication lists, which should include all prescriptions, over-the-counter medications, supplements, and herbal remedies, a medication schedule, and a medication administration record, also known as a MAR.
So I'm going to talk about health promotion. I labeled this slide as your health, your power, taking control of your medicine. So some things we can do to promote health is lifestyle changes, focusing on non-drug options like diet and exercise, and setting health goals with your doctor. These support self-management. We may not get to pick what medications we're getting prescribed, but we can, for the most part, pick what we do with our day, what we consume, and how much exercise we get. And that gives you a little bit more power when you have the choice. Community resources. So look for local health programs that improve medication management and adherence. I know that the YMCA has great resources. You don't necessarily have to be a member to reach out and to be in these classes. It's actually a very great resource. I went to one for my community agency, so I recommend. Just simply understanding your medications. So ask for simple instructions. Visual aids are really big. Use teach back method. And make sure you know why and how to teach or how to take each medication. Thanks to Green in her lecture. Quality of life, so adjusting your medication plan, including stopping unnecessary medications. I talked about this a few slides earlier. This can improve independence and overall well-being, but this we have to be careful. We have to consult our provider and, let the patients know that they can advocate for themselves. And yeah, this is sometimes this can improve a lot people's independence and their overall confidence.
Life has enough challenges, and your health shouldn't be one of them. We have listed some community resources to assist in some of the areas of disparity. Income. Be sure to check with your provider or hospital about financial aid services. Ask about generic medications and alternative therapies like diet and exercise. Access to healthcare can also be a challenge, but agencies such as Catholic Community Services offers transportation to medical appointments, pharmacy, and even grocery shopping. Even Walgreens has mail order programs. Don't let polypharmacy impact your social life. Puyallup Senior Services offers a wide range of physical activities like yoga, strength training, group games, blood pressure screening, and arts and crafts.
One of the key takeaways you want to know is knowing your medications. Understand the name, purpose, and dosage of each medication you are taking. It's helpful to keep an updated list. Carry a written or digital list of all prescriptions, over the counter drugs, and supplements. You can watch for side effects, so report new symptoms like dizziness, confusion, or stomach upset to your healthcare provider. Don't assume it's due to aging. We can avoid duplication, so sometimes different doctors prescribe similar drugs, so reviewing your list helps prevent any overlap. You want to ask before adding, which means always check with your provider or pharmacist before starting a new medication or supplement. Also, you want to simplify when possible, which is using pill organizers or aligning doses with daily routines can reduce mistakes. Last but not least, remember, you are the team leader. Staying informed and asking questions makes you the most important member of your healthcare team. In conclusion, polypharmacy rates have tripled since 1990. This proves that polypharmacy is not an exception, but is the norm in older adult care. Managing complex regimens and recognizing when interventions are needed is important. When medications are not managed, this can cause an increase in morbidity and puts older adults at risk for mortality. Note that certain medications can impair physical and cognitive function. It is important for nurses to educate the patient how frailty alters pharmacokinetics and pharmacodynamics. In frailty, we see a decrease in physiologic reserve, and we see increased vulnerability to adverse reactions. Be open to talking to your nurse or provider and discussing medication concerns effectively. In doing so, this can enhance quality care, which improves patient outcomes through better medication management.